Good morning, everyone. I'm Dr. Sachin Borkar, working as a neurosurgery faculty at New Delhi, and I shall be talking about cervical laminoplasty and post-laminoplasty cervical spine alignment. As you all know, that cervical laminoplasty is a very effective operation for multi-level CSM and OPLL, and it also causes some destruction of the posterior tension band. So theoretically, it should also cause some post-laminoplastic kyphosis, and if not kyphosis, at least a loss of cervical lordosis. And there are various parameters which have been described nowadays in literature for post-laminoplasty cervical alignment, and T1 slope is one of them, which is actually the line between the upper end plate of T1 and the horizontal. We also conducted a study of 85 patients post-laminoplasty, and what we observed that the incidence of loss of cervical lordosis was higher in patients with a high T1 slope preoperatively. The same is sustained in a multivariate analysis that a preoperative T1 slope being high will cause a significant loss of cervical lordosis in the postoperative period. And we found out this cutoff of 29.5 degrees of T1 slope as per the ROC curve for predicting significant loss of cervical lordosis. So as you can see that a low pre-op T1 slope, a 25 degree in this case, didn't cause much loss of cervical lordosis in the post-op period. However, a high T1 slope of 32 degrees caused a significant loss of cervical lordosis in the post-operative period. We also found out a novel concept of the dynamic extension reserve during this study. And what dynamic extension reserve actually means is the difference between the extension corps and the neutral corps. So it actually represents the contraction reserve of the posterior tension band during dynamic movement of the spine. And there is a dynamic interplay between this anatomical demand in the form of T1 slope and a functional demand in the form of contraction reserve of the extensor muscles of the posterior tension band that works to counter this anatomical demand. There is a definite interplay, and we came out with a classification and given score to each of the component, the preoperative corpse angle, T1 slope, and the DER. And this has been published in World Neurosurgery. And what it actually means is if there is a low T1 slope and a good dynamic extension reserve, such subgroup will have significantly less chance of developing a loss of cervical lordosis. However, a high T1 slope with a poor dynamic extension reserve will cause significant loss of cervical lordosis. So this is the odds ratio plot saying the same thing, that the loss of cervical lordosis, significant loss of cervical lordosis, is inversely proportional to the dynamic extension reserve and directly proportional to the T1 slope. We also calculated the quality of life parameters following laminoplasty, and as you can see that there is improvement in most of the components of the SF36, and the global SF36 also improved following laminoplasty. So it's a gratifying surgery. We also correlated the loss of cervical lordosis with JO recovery rate. And in a patient with significant loss of cervical lordosis, though the trend was towards a poorer functional outcome, but it was not statistically significant. Same with the NDI improvement. The trend was there, but loss of cervical lordosis did not significantly affect the NDI improvement, as well as the SF36 improvement as well. And there was a linear correlation between this NDI improvement and the JO recovery rate, as well as the MDI improvement and the improvement in SF36. So to conclude, cervical laminoplasty can also cause a significant loss of cervical lordosis in a subset of patients. And this subset is a patient with high T1 slope and a low dynamic extension reserve, which can cause a significant loss of cervical lordosis. The functional improvement has been good in laminoplasty, and there is improvement in SF36 scores, many of the components, as well as the global SF36 also improved following laminoplasty. So it's a very functionally rewarding surgery. The loss of cervical lordosis did happen in a subset of patients. However, the difference was not statistically significant in as far as the functional outcome is concerned in both the groups. Thank you for your kind attention.